board certified family physician. I'm board certified in obesity as well. So I have been a physician for almost like a decade. And what I've noticed is a healthy woman, like predominantly healthy woman, when she starts seeking the healthcare is in her 40s. Like, I mean, that's when and that is the beginning of the perimenopause. And a lot of times this is the most important stage of women's life, and a lot of times it's misunderstood. No one really talks about it, and we are just taught to deal with it in silence. We were never provided the education regarding this. We were never provided the tools. And today I really wanted to bring out all the tools available, what is evidence behind it, and there's a lot of misinformation out there. So with this menopause symposium, I really wanted to bring those things to you all. So mainly I really wanted to take away is this is an important phase of life. Our 40 to 55 years of women's life decides how you're going to lead the next 30 years of your life. And we are at the peak, we are at the peak of our careers. We have children who are growing and they're almost in colleges, or some of them are in colleges, and we want to live a healthy life and a happy life. So I really wanted to tell them this is an important phase of life. Take control, take charge, and do reach us out. We are here to help you out, and there are a lot of resources and there are a lot of misinformation. Don't believe that. Do reach your primary care provider. Do reach out to a menopause certified. I'm a menopause certified provider. Do reach out to us and we can help you guys out.
Thank you.
So when you lose your lean body mass, your metabolism slows down, and that makes you gain weight. And the other thing which happens is because of your low lack of progesterone, your sleep gets disturbed. It protects you from a lot of other things which can happen. It actually saves families. And hormone replacement therapy, it's for everybody, but there are some contraindications what we go through. One is if you have a estrogen positive breast cancer, you cannot take estrogen or progesterone positive breast cancer, then you cannot take that. Or if you have a blood clot, you cannot take it. Or if you have an MI, then you cannot take that. But all the other patients are not very high risk for that. And other effective remedies are omega-3 and
Menopause Society certified provider. Her passion and inspiration is treating the whole woman. Dr. Gandhi is uniquely skilled as a surgeon and metabolic and hormone healthcare provider for women seeking answers to complex disease process. I am very honored to introduce Dr. Gandhi. Thank you, Dr. Gandhi. Stage is all yours. Thank you so much.
Because you go to your doctor because you have problems, with hot flashes and maybe weight gain and mood symptoms. But the last thing that a woman usually tells me is, hey, my husband's been telling me I don't really feel like I'm in the mood, so can you help me out with that? That's down here, because by the time they come to see you and talking about all this other stuff, they don't see that as the most important value, but it is quite valuable, and I'm here to kind of educate you guys about it. So, okay, so I really like to use humor.
Estrogen, how can you stay on top of it? How can you go to your physician or a healthcare provider and say, hey, this is what I'm concerned about? These are normal numbers. Blood pressure needs to be 120. It doesn't matter if your blood pressure has been in the 140s for the past 10 years. It needs to be less than 120. If it's not, we have to talk about it. Same thing with fasting blood sugar. Hemoglobin A1C is an indicator of diabetes, prediabetes. We have to understand those. Know how much triglycerides you have. What are your good HDL numbers? And waist size.
That used to be called vaginal atrophy, vulval vaginal atrophy, urogenital atrophy, a lot of different terms, but genital urinary syndrome of menopause is very informative. Why? Because it says exactly what's going on. It's symptoms involving the genital area, the urinary area during menopause, and it can actually happen in perimenopause. And so it's been shown in studies to affect up to 80% of women in perimenopause and menopausal years. So that's almost every woman, 4 out of 5 women, right? It also affects women who go through premature menopause.
So, and I'm also certified in dry needling, as well as level 1 certified with Herman Wallace. So, brief overview, we'll go through statistics and some symptoms that are common. We'll go through pelvic floor physical therapy, and then we'll go through
experience a relapse of depression during menopause.